Hi, good afternoon, everyone. Welcome to our another Facebook Live workshop. Okay, for today, ask Charlie anything. We're going to talk about understanding autism with Liyana. She's our in-house clinical psychologist. So today we're going to talk about autism from the perspective of a clinical psychologist. Okay, these are our following upcoming workshop. Next will be a Facebook Live as well, balancing and coordination by our occupational therapist, Miss Alia. And then we have a guest speaker, Dr. Hannah from UKM. She's a dietitian. She's going to talk about diet and children with autism. All right, so before we start, I would like to introduce about Mind Story. So basically, for those who follow us, they know that we provide services for children with special needs. Special needs includes academic delays, sensory delays, developmental delays, behavioral and emotional difficulties, as well as physical delays. So our team is a multidisciplinary team, which consists of academic support, behavior therapists, clinical psychologists, counselor, OT, reading therapy, and speech and language therapies. Okay, you can contact us at this number. We provide free consultation. Okay, and you can check us out at Facebook, our community group, Facebook page, LinkedIn, Mind Story, our website, as well as Instagram. Okay, let us welcome Miss Liyana. Hi, Liyana.
Hello, Charlie. Thank you for having me again.
No problem. Okay, so today we're going to talk about some topic that has been widely discussed. Okay, I believe almost every month there's definitely a talk about autism. Okay, so today in particular, it's good that we have a clinical psychologist here to talk about autism, to share with us what's autism, okay, and what we're going to talk about autism today. So firstly, what are the characteristics of autism from your perspective?
All right, before I start with the characteristic, Charlie, I would just like to define what autism is, right? So autism is autism spectrum disorder, or ESD. All right. So when we talk about autism, it's under neurodevelopmental disorders. All right, in regards to the brain. All right. So some people may ask, like, can my child develop autistic criteria after like certain years? All right. So basically, that is a no, because autism or ADHD or SLD or ID, those are all under neurodevelopmental disorders. So it has to happen after birth, all right, because it regards to the brain, all right. There's imbalance chemistry in the brain and whatnot. So that is how autism or neurodevelopmental disorders works. So you asked about what are the characteristics of autism, right?
Yes.
So the main three things that we do want to look for autism or is first is the social interaction. All right. So when it comes to social interaction, we have difficulties in terms of initiating interactions with other people, or even interacting with other people. Most children with autism, they develop an isolated play, or they play by themselves. Even if you sit next to them and share, and what you want to share things with them, they would usually is either they would not want to play with the toy that you play, or they just take the toy that they want to play and move further away from you. All right. Basically, there's no interaction. So sometimes parents would also ask, like, no, if my child is autism, why is it that I'm able to actually play with them? So we want to define how you play with them, right? Because that is one of the characteristics of autism, all right? Because they usually have isolated play, right? So less social interaction and whatnot. So that's the first criteria that we want to look at, which is social interaction. Second of all is the developmental milestones, right? Most autistic children have delayed developmental milestones, where, for example, delayed in speech, delayed in fine motor skills, delayed in gross motor skills and whatnot. All right. However, that does not define autistic alone. So some people say that, oh, my child has delayed in speech. So does that mean she or she is autistic? All right. So like I said, it has to have three criteria that we want to look at. First is social interaction. Second is muscles, and the third one is repetitive behaviors. All right. So repetitive behaviors, or what we call stimming, is one of the major characteristics of autism. All right. So some people would see flapping hands, for example. So they would do this, all right? They would flap their hands most of the time. They don't have a time for them to flap. They would always flap whenever they feel like it. All right. So it's not like, oh, my child flaps when he or she is happy or excited. Right. So that means there is a reason for them to flap, and sometimes it's just a face. But if it's an autistic criteria, they would flap regardless of the timing or regardless of the reasons, environment it is. All right. So one thing is flapping hands, repetitive behaviors of stimming. It can be rocking of the body back and forth. All right. So back and forth, back and forth, back and forth, or knocking their head on the wall, knocking their head on right. So anything that has been done repetitively. All right. There's no reason to it. It's just being done repetitively over and over again, and you can see it every single day. Then that is considered as repetitive behaviors. So like I said, the three, like what you asked, what are the criteria? Those are the three things, right? So social interaction, developmental milestones, and also repetitive behaviors, Charlie. All right. Hope
Okay.
that answers.
Yeah, it's very good. Well defined. If you have any question, feel free to write in the comment so I can relay to Miss Liyana. So yes, the reason why I asked this because for me personally, I experienced a lot when I meet parents. Sometimes they have different characteristics, but I'm not too sure what are the characteristics or the criteria because it's defined by the clinical psychologist or health professionals like developmental pediatrician. But what I know is as a clinical psychologist, these criteria fall under the psychosocial, okay, for children. But for the doctors, they have biopsychosocial, means that they can rule out certain things based on the biological factor, which is not from clinical psychologists. That's why I'm very curious about the characteristic or the criteria. How do we know as a lay person who are not in the clinical psychology field, which is good because it really answers my questions. Because I always wanted to know, like, there's so many things about the characteristic, like criteria, because there's a lot nowadays. We have access to a lot of information, but we don't have the definite answer. So it's really good that you pinpoint it down to three major or the three criteria that has to be met to consider a child to have an autism or with a criteria to be autism. Okay, so when you mention about as the spectrum, it's like a wide spectrum, wide scale, right? So from there, how do you know like which spectrum is a child is like?
All right. So when we talk about autism spectrum disorder, right, it's within the spectrum itself. So when we need to understand what the spectrum means, it means it's a wide range, right? So how would you define the spectrum under the autistic level, right? So for you to understand the spectrum is a wide range. So for example, there's a child A has criteria of autistic, right? Autistic criteria. And then child B also being diagnosed with autism, all right, but does not share similar criteria or characteristics of child A. And why is that so? Right? That because it falls under the spectrum that you mentioned just now. All right, it's because that is a wide spectrum. It does not have one person should not have all the criteria, and it should not be defined as similar as the other person. All right, one person may have this and the other person may have that. All right. For example, just now I explained about the repetitive movements, repetitive behaviors, right? So like I said, there's clapping hands, there's rocking movements of body, all right? There's a lot more criteria of that, a lot more examples to that, all right? So let's say child A has clapping hands criteria, all right? And child B has probably the back and forth, what do you call that? You pour the water back and forth, back and forth, back and forth all the time, all right? So that's what I mean by spectrum. It does falls under the repetitive behavior, but it's not the same. It's not the exact same behaviors, right?
Oh, okay. So
So
so the
when we talk
criteria,
about the
yeah.
level,
Mhm.
so when we talk about the level as well, so they also differentiate between the spectrum as well. All right.
Mm.
So not only the criteria difference in terms of the level as well. All right. So certain level, certain impairments would be under the mild characteristics, and certain level would be under the moderate and also the severe part. Yeah.
Okay, so I get it. So it really depends on the criteria. From the criteria, how big is the impact, or how big are the impacts on the child? Then only they will be placed in a spectrum of mild, severe, or
Moderate or severe.
moderate, severe. Because I've seen a lot of reports. I get confused sometimes because doctors will use level 1 K, level 2 K, level 3 K. Some who are really specialized, like especially developmental pediatrician, they will go for the spectrum, mild, level, moderate, severe. So that's where I got confused. That so how do you determine like a level 1 or level 2K or level 3K or mild? So thanks for the explanation. Now I know that from a clinical psychologist point of view, when you see a child with the criteria of autism, then from there you will further see how much is this criteria affecting the child. Am I correct? And then from
Exactly. So basically, how much the behaviors or the criteria impairing the child's life. So, for example, if the behavior, repetitive behaviors is very harmful, for example, rocking the body or knocking the head on towards the floor or towards the wall, so that is already harming himself. All right. So that would be probably under the higher spectrum. Yes.
Okay, so it really determine the criteria will determine the way you fall under the spectrum. Okay. So, all right. So for those who are out there, when we talk about psychosocial, meaning that we see the person in terms of the psychological point of view as well as the social, like what Miss Liyana has explained just now. The criteria is 3. One is the behavior of repetitive behavior with no reason. You don't need to reason, like what she has shared, pouring water back and forth. There's no time, there's no reason behind it. You can't define the action of pouring water back and forth, and then also have difficulty initiating interaction or socialize. I assume that the child will tend to play alone and not interacting with other child if you put them in a play setting. And then the second one will be social behavior. And what's the third one? Yeah.
Repetitive movements, developmental milestones, and repetitive behaviors.
Yes.
So the developmental milestones.
Developmental milestone will be depending on the functions of, like, for example, speech is not properly developed or not really functioning. That's where is it possible for the child to have all these 3 criteria?
Yes, it is possible, Charlie. So maybe probably if it is impairing most of the functionality, maybe it falls under the higher level of spectrum.
Okay, so meaning that if they meet all the criteria and it's affecting their daily functioning, like going to school, brushing teeth, then it will fall on the severe side of the spectrum.
You're right.
Okay, all right. So the reason why I ask this also because I really want to know this criteria when it's met. Then by determining the level or the which spectrum that they fall into, then we can roughly know the child's functioning on a daily basis. So meaning that if the higher end, which is the severe, whereby these three criteria will be met, and also it's like whereby the behavior of like head banging on the wall, and like speech will be, I assume, will be, so there's a great delay in that. Okay, so now I have a
So basically,
better.
if for those who are in the severe side of it, they would definitely need more care for them, right? So that's differentiate also between level 1, level 2, and level 3, or mild, moderate, and severe. The more severe part of the criteria, the more support that the child would need. Yeah.
All right. So that's from there. That's where my next question will be. So for us to know the criteria, then definitely we're gonna talk about diagnosis. Okay. So because in the diagnosis, this is where it will list out the criteria. Am I correct?
Yes, you're right. You're
Okay.
right.
So because for me, from what I know from doctor's perspective, they have a standardized assessment. Okay. So, but for clinical psychologists, if I'm not mistaken, they has few assessment. Am I correct?
Yes, you're right, Charlie.
Okay.
So in terms of the assessment for clinical psychologists, right? So we use CARS or GARS, all right? So that is basically to rule out the autism spectrum disorder, all right? So we have that for, and also we sometimes we include IQ tests as well, especially for those who diagnosed at the age of 6 and above. So it means that they have went to school, but then they have difficulties going to schools, right? Probably managing themselves at school, or having great delay in terms of understanding, right? So probably the criteria is not as severe, all right, or it's not as obvious, all right, but it's been affecting. So with that, we would use IQ assessment as well, just to check whether if the child is able to go to a mainstream school, right, means that the criteria is mild. So if the child is able to go to the mainstream school, so what are the supports that the child needs from the school, and can the school provide? If the school could not provide the support that the child needs, probably the parents would have to consider other schools, or probably the schools need to adapt or change certain things for the needs of the child. Yeah.
Okay. All right. So you mentioned GAS and CAS. That's the abbreviation, right? For GARS and CARS.
Yes.
Okay, so for those who are out there, if you're looking for an assessment from a clinical psychologist for autism, you can look for this name, CAS or GARS. Can you briefly explain, because I know there's a lot of technical terms which we will have a hard time understanding. Can you briefly go through like why there's two?
Okay, hold on. Just let me. I forgot the full word. Okay, CARS.
Okay.
So basically, there's two because it's from a different publisher. All right. So there's one. It's. Oh dear, I really forgot. I'm so sorry.
It's okay. It's okay.
All right. So basically, yeah, there's two because of different publisher. So if when talk about cars or GARS, it's quite similar between the two. It depends whether it's not greater than the other. It's quite similar. So some centers and some hospitals prefer to use CARS. CARS, but some prefer to use GARS. So it's okay. There's no differentiation. No one is greater than the other. So it's okay to it, as long as you know that that assessment is particularly to diagnose or to assess autism.
Okay.
Yeah.
All right. So to all, including me, to all outside, if you're looking for autism assessment, there's no differences in terms of like one is CAS is better than GAS, GAS is better than CAS. It's really depend on, I would say, correct me if I'm wrong, the preference and the comfortability of the clinical psychologist or the organization. So, and both develop to detect the criteria of autism. It's just that they are developed by different publisher or different organizations.
Yes.
And both are useful. Okay, and also you mentioned that after doing this assessment, you give it an example of a student where if it's a child is above 6 years old, then they will go for IQ test. So for my question is, do you have an age limit on this autism assessment?
Sorry, what was that?
Do you have an age limit? Because
Age limit.
yes, how young can you detect by using this autism assessment?
All right, because I'm familiar with CARS, so CARS, that is, okay, I found it. It's Childhood Autism Rating Scale. All right, so for CARS, it's from 1.5. So basically from 2 years old, we take it, all right, from 2 years old and above, all right. So for IQ test, we require from 6 years old and above, all right. So for a child, for those who are under 6 years old, wanted to diagnose or to rule out autism, who go for CARS alone, not with IQ test. All right, like I said, why IQ test is sometimes is necessary because the child has entered the school age. All right, so being able to go for kindergarten and whatnot, preschool and whatnot. So being able to adapt, but somehow has limitations during the primary school. So that's why we add on the IQ test to help them develop or to help them understand, to help understand how they learn and how their abilities and to work with their strengths and weaknesses for them to better learn in school. So that's why sometimes IQ test is a need, accompanied by CARS. Yeah.
Okay, so the age limit for CARS, CARS, will be 1.5 years old.
1.5 to 2 years, yeah. We say we take 2 years old, yeah.
All right. While the intelligent test, the minimum age is 6. Okay.
6 years old, that's right.
All right. So I see there's a pattern of diagnosis, meaning that, let's say if my child, I will send for screening for autism. Then after that, there will be follow up with other diagnoses to further find out the difficulties. Am I correct? And
so
one
if
of them,
yeah, so if your child is under 6 years old, then we would just do CARS alone. But if there are developmental milestones related to it, then we would also recommend for VABS. For VABS is Violent Adaptive Behavior Skill. So that one could identify for example, there's a lot of domains, for example, communication, socialization, behaviors and whatnot. So those we need to understand in those developmental milestones, where does the child level is, right? So we need to identify which one's level, whether it is sufficient or adequate to their age, or if it's under, if it's over, what is it? So for us to help and to help those to identify what are the therapy needed for later for the child.
Okay, understand. So to everyone out there who joined us today, including myself, it will be a separate assessment. Okay, I thought it was all in one. Okay, my bad. So it will be CARS to determine only if the child has the criteria or meet the criteria of autism.
Yes.
And then you'll do a further assessment. For example, you mentioned that Violent Adaptive Skill, which is VAPS, if I'm not mistaken. VABS, sorry. Oh, adaptive behavior, VABS, to determine the functioning level of the behavior or other adaptive
developmental
skills.
milestones.
Correct. So CARS will be one assessment. VABS for the milestone, developmental milestone, will be another assessment. Okay. All right. And
if it's needed for 6 and above, IQ test.
So this is all separate assessment to find out each of the function. They have their own specialty. Okay.
Exactly.
All right. So VABS will be on developmental milestone. Okay. To all the people that attend the workshop, I mean, just join us today. Development milestone means that the child at certain age, they have to have expected skills. Am I correct?
Yes, that's right. So according to KTM, there are certain, at every age level, at each group, you have to meet a certain criteria criteria or certain criteria of developmental milestones that you need to follow. When you don't meet or you don't reach the age criteria, the age milestones, then that means your child may be underdeveloped. So we need to give focus on that. Yeah.
So chronologically, the child can be 9 or 7 or 8, but if they have difficulties, meaning that their skills or their expected developmental age will be under age.
Yes, okay, so that's right.
So meaning that there's a gap between the real age and their developmental age. Okay, all right. So for those who join us today, that's what, if you very familiar with it, if you see doctors or if you're working in this field, a lot of them will use this term developmental milestone. Okay, developmental milestone is like what Miss Liyana has talked about, which is a certain age the child has an expectation to meet a certain maybe skills or speaking or speech has to be at this age is supposed to have or expected to have certain skills of talking or speaking, and then maybe they have a certain understanding. If not, that's where you have another assessment for like IQ test to know. Okay, all right, that's very good. And we talk about the age as young as 1.5 years old. What about the highest? How old can it go for CARS, for CARS?
For CARS, if I'm mistaken, is until 16 or 17, if I'm not mistaken. Yeah.
Okay. All right. So for those who are looking for autism assessment, especially CARS, which is what Miss Liyana is, her preference of using that assessment. So the age is about 1.5 years old to 16. Okay. All right. And then I'm curious to how long is this assessment? Because I assume that it's going to be like a question A, right? So you will be. Can I know like what's the process? Would you ask the parents, or you will like how does it go?
Okay, so I think for those who have followed us in the previous seminar, I did explain how do we want to diagnose, the process of diagnosing, right? So first level is once we would call it the consultation or intake interview, all right? So that's where I would ask whether if this child presented with these symptoms and criteria and whatnot, just for as a screening part for me to decide whether to proceed with CARS or with binding test or with whatever, right? So I would determine based on the interview intake first. All right, so that's the first consultation session. So after that, if usually for the interview intake interview session, that would already take up around 1 hour to 1 hour and a half. All right, so the next session will come is with the if the child needs to have the CARS, for example. So that would be a semi-structured interview. So we have a list. I would have a list of questions, whether to see whether the behavior is presented or displayed, whether it's frequent or not, whether the child has difficulty doing this or the child does not have difficulties. So I would interview parents with that. So basically with just the parents itself. All right. Okay. And then after doing all that, that would usually take around 1 hour. All right, 1 hour session. Then I would also ask the parents to come back again. And this time I would do observation. All right. So observation would take around 30 to 45 minutes. It depends on the child. All right. Sometimes it lasted even an hour just to observe whether if the characteristic of the autism is presented while I was interacting with them or not. All right. Like for example, when I would do the observation session, I would look at the three main things I mentioned just now. Right, the social interaction part, and then the developmental milestones, and then the repetitive behaviors. All right, so that will be observed during the observation session. Right, and then I would determine whether if the mom or the parents would want to proceed with the developmental milestones, because it's not a need, but it is an option, a very good option for you to take. All right, to do the assessment as well. At least we would know at what age. Although, like you said just now, Charlie, chronological age is between the real age, like for example, certain years and certain months, certain days, right? So that's a chronological years, that's the chronological age for the child. but we want to know the developmental milestone is up to the chronological age, or is it under, or is it over? So we need to know that. All right. So that would help us to actually understand better whether to decide whether those the abilities are affecting or not. Right. So sometimes parents would say that, oh, my child couldn't pick up certain objects, or my child couldn't do certain things with the fingers. Then that is referring to the FMS, which is a fine motor skills, which is being observed or being screened in the VABs, binding adaptive behavior milestones, right? So that is why we need to do all that. Just to explain to parents, this is why we see that your child is unable to do certain things. So that gives a little bit more further explanation to the parents to understand better of their developmental milestones and how it affects in their daily routine as well. All right. So for example, if the child is under 6, then I would stop there and then would brief the report, for example, another 2 weeks. So if the child is 6 and above, then I would ask the parents, or I would recommend for the parents to proceed with the IQ test. And that would take with the child itself for 2 hours in the next session. So we don't lump up all the session in one go, because that will be tiring for the parents, it will be tiring for the child, it will be tiring for me as well. So we would have to separate the sessions as well, all right, accordingly. Yes.
Okay, all right. Well, that's very detailed. Okay, so basically, how long or what's the process? It's all together, I assume. Okay, just for the autism assessment itself, it's divided into few processes or different stages or different sessions. So the first session will be a preliminary meeting with parents, just to get to know them, and then whether yes or no, it will be decided on that day. Am I correct? So how long is about how long is this prelim meeting?
So receiving consultation is usually from 1 hour to 1 hour and a half. It really depends. Yeah.
Okay. So this is without the child, right? Just the parents?
Yeah, sometimes the parents do bring the child. So while I'm interviewing the parents, I would also observe the child as well. So I would sometimes like point out, oh, is this behavior normal, or this child do this behavior often? So just to get a clear cut whether if whatever the information that's given by the parents is portrayed by the child at the same time. Yeah.
Okay. So before the assessment day itself, there is initial consultation or preliminary meeting just to understand the parents. So it takes about 1 to 1.5 hours. Okay, that's how long it is. That's the first stage. And then after that, if the child, you determine that they need to go for an assessment, then it will go to a second session, which is the CARS or CARS assessment day itself. So during that assessment, you'll be okay, the first stage, initial consultation, it will be like interviewing, and if there's child there, then you can observe. Okay, that's the style of initial, I mean, that's your style of doing the initial consultation. The second session will be the assessment day itself. If you determine that on the first session, after the first session, that this child needs to have assessment, then we go on to the assessment day, where second session will be assessment day, where you the style will be interviewing parents as well.
Yes, sometimes parents would ask during the first intervention. What you already asked this type of question? Why are you repeating it with the assessment? Like for example, in the CARS, right? Why I'm doing it, because I want during the first intervention, first consultation session, I would want to know whether this behavior is developed because of negligence from the parents, or is it because of the developmental milestones delayed from the child itself. So that's why I need to have the similar question when I have for the CARS. So basically the first session is just to screen out and to understand whether that behavior or that milestones or development is caused by the negligence of the parents, or the lack of social interactions probably from the environment. Is that because of the environment and the parents, or is it because of the developmental neurodevelopmental issues? So that's why I need to have those. Yeah.
Thanks for sharing. So for those who are listening, including me, please don't get stressed out because that's on her side. It looks busy, but not on us. Basically, if we were to attend, she's just going to ask us questions, but what she's explaining is from her point of view.
Yeah.
Okay, where she'll be, observing, monitoring, interviewing, and to find out more. So that's a part. So basically, the second one, sometimes you might find the same questions, but this is for her to look at to outline some or to clarify some of the questions that she had. So on the assessment itself, mostly the clinical psychologist will work with the parents in terms of interviewing to get more information and then because these assessments, psychological assessments are mostly in terms of question A. Okay, that's why and that's why I assume that parents is very important, or the caretaker or primary caretaker, it's very important, which I will ask later. But for now, that's why it's very important to have parents around on the second observation or the assessment day itself, because it's really good to feedback to the clinical psychologist like Ms. Liyana. And how long will this take? About 1 to 1.5 hours?
This will be usually in 1 hour.
Okay, all right. So then after that, it will take you about 2 weeks to produce the report.
Yeah, if that is just the session, means that there's no more addition to Vineland or IQ test, and yes, 2 weeks after the course, then the report briefing session.
Okay, so for all the viewers, this is how long and how many the process just on the autism assessment. Okay, from her point of view, she'll take 3 sessions and about 1 hour each session. Sorry, 2 sessions and 2 sessions, and that's about 1 to 1.5 hours to determine. Okay, and also she stated her reason whereby, if you were to sit during the initial consultation or the prelim meeting, and then you have to follow up with the assessment itself, then it will be quite tiring. It will take about 3-4 hours. Okay, provided that there's no taking breaks, like straight, from the start until the end. There's no break, there's no nothing, but it will be tiring, and yeah, I don't think it's a good idea as well to sit through it. Okay, so that's where we can move on to my next questions. Okay, and then because normally I have parents asking me, so I got this assessment, what's next? What to do? So from my understanding, from your explanation just now, it's very thorough. I like it. It's very detailed because it's answered a lot of my queries. I have a lot of questions, like it gets me interested, like, wow, what do they do actually in the session? Because I can't be in the session. So thanks for explaining it. And then that's where after the report, after 2 weeks to produce the report, and then this is, I will say, the new session or follow up. Okay, either way, up to you how you want to put it. The following session after second day, after second session would be, to discuss the result. Am I correct? Yeah. So this is where.
Yes, that would be correct.
Yeah.
So
this is where Ms. Liyana will explain the result and to recommend what's the next step. So normally, like she explained just now, if she found out that the behavior or the what I call this developmental milestone, there's a gap, or she suspects there is a gap, that's where she'll recommend the next step is to do the VABS, okay, which is the Vineland Adaptive Behavior Skills Assessment. This assessment itself is to find out the delay, if the child has experienced the delay, which is to answer the question on the first assessment, correct?
Usually, I do not wait until the report to come out first. I would explain to the parents why I want to do the VABS before I do the report, so that they don't get separate report. They will get both assessment in one report so that it's easy for you
Ah,
to refer. So I would also explain to the parents why I want to do the VAPs before we do the result session is because I see there's a developmental milestones during my observations. So those are the things that I need to explain to the parents and make them understand why it's important for me to do the VAPs or the IQ test, right? So I don't simply say, okay, I see that you need this, so we're going to do this, so it comes in a package. So I don't do that. So from my practice, I see that if I see it's necessary for the child to do this assessment, I would explain to the parents, okay, I need to do this assessment because of this. I need to see this, so that I can explain in the report and back each other's. For example, if I do VAPs and assess cards, so the result would actually support one another, right? So that's
ah,
why I need to do both probably during the session. Yeah.
okay, understood. So after the second session, which is the autism CARS assessment, then the second one follow up will be either the parents, this is all parents' choices, right? If they choose not to, then the third session will be just meet up and to explain what's next. Or during the second session, when you recommend what to do next, they can opt for it and go for the third session, which is observation on the particular area that need to be assessed on. For example, what do you call this, the developmental milestone, which is the VAPS. Now I see it. And then after that, then the report will be combined into one, and then you have two types of result, I assume, will be inside.
Yes, that's right. Sometimes, Charlie, I just want to add, sometimes parents would ask, probably in the viewers, they might want to ask that, why, if you see that that is necessary for the child to have assessment, why would you give the parents an option whether to have it or not, right? So from my perspective, I would have to understand from the parents' perspective as well, right? Sometimes doing an assessment private sector is quite expensive, even for the first CARS assessment, right? So I would explain why would I need the second assessment, which is the VAPS, right? So sometimes VAPS is also costly. So I would ask whether if the parents would be comfortable doing the session or doing the assessment at the same center, or do the parents want to do it somewhere else, probably in the government hospital to do that, right? But then again, I would explain the pros and cons as well, all right? Doing this here in the private sector, what are the pros and cons, and doing in the government hospital, what are the pros and cons? So I would give options to the parents to decide, right? So I would always explain to them, whether regardless they have questions or not, I would always explain to them in details whether they know what are the decisions, what are the options that they take. So not just yes, and then go out of the session. I don't remember what Miss Liyana said just now. All right. So I would explain and ask whether, do you understand? Do you need my help in explaining? I could go over again, and it's okay for that to happen. All right.
Yeah. All right. So for all the viewers, yeah. So basically, that's how long or the process altogether. Okay. It can be 2 sessions. It can be 3 sessions. It really depends on how many assessment or recommended assessment and what to be assessed on. And please do ask your clinical psychologist, because I do meet a lot of parents, after assessment, they'll be like, or assessments, more than one, and then they'll be like, what's next? All the written thing, I don't even understand. So please do ask your clinical psychologist, because there's a lot of technical terms, okay? So that's where I also learning from clinical psychologists, because some of the parents, when they come and see me, I have almost zero clue on certain things, because I study psychologist, but I am not a trained clinical psychologist. I'm a counselor. So for me, I do a very, very basic screening or assessment, but not really a complex psychological testing. So this is where I always recommend parents, or I will ask on behalf of them, like, can you please explain what's this result, or what's the next one? Because normally after the assessment, like what Miss Liyana say, she will recommend certain things, and she will explain to parents what to do next. So if it happened that your clinical psychologist say or did not say, feel free to ask, okay? because you pay for it. It's really important because if you come to me, or most of the time I see parents, I wouldn't know what's next, okay, because that particular report is written by the clinical psychologist, and they know what they are writing. I mean, I can read, I know, but I don't really know exactly like the condition of the child. We can see it's very obvious, but there are certain recommendations based on that assessment itself. They have like a tailored to the child, what the child difficulties, and when, let's say, after CAS, there's a behavior, you'll do VABS. Under VABS, I assume that's a recommendation from them as well, right?
Yes, yes, that's right.
Okay, all right. And also, Miss Liyana brought out something that I want to talk about, cost. So this is where it's really good to ask, okay, the clinics or psychological services or hospital or private hospital, wherever you go, if you want to go for assessment, please to ask first. And then how do they charge? Okay, some they don't give you a report after the assessment. Why? Because you have to pay for the report. So it's very good. I mean, I would recommend parents or suggest parents to ask the clinic before you engage in anything. Okay, some they provide initial consultation with no charges. Feel free to ask them as many questions as possible. I guess from there you can know what to expect from that assessment, like what Liyana has explained everything in one. The process of the assessment, how long of the assessment or each session. The process can break down into few sessions depending on what type of assessment you go for, but definitely they will have initial consultation. And then she will talk about recommendation after the assessment and what to do, what's next. Okay, and also always ask how much does it cost. Okay, if you worried about cost, ask them, and then that's where you can ask also like what to do next, because it's expensive. So this is where the clinical psychologist can direct you to the right person or to the right place. Okay, it's okay to ask them that. Okay, you don't need to don't need to worry about like, oh, I shouldn't ask her. Then after the session, you feel bad for not asking. So so take the opportunity to ask as many questions as possible, because personally I do that as well. When I go see a doctor, if I have a flu, I will ask a lot of questions. Okay, because for me, I want to know why. So same goes to parents out there or teachers or anyone. If you're looking for assessment, please ask as many questions as possible. And then move to next is, just now we heard that Ms. Liyana talk about interviewing family members. It's the style of the assessment. Okay, this is what I want to talk about. Stakeholders. Okay, if you see, not only business, we'll talk about stakeholders in health professional. We do talk about stakeholders as well. So what are the stakeholders? Basically, is who are the one that taking care of the child, or who are involved in this child's therapy or assessment or intervention. So when we do planning, we need to know, we need to identify who are the stakeholders. One of the most important one that I always tell parents is the caregivers. Sometimes sometimes the child, you are the parents of this child, but you may not be the primary caregiver. Why? Because you're working outskirt, your child is with the grandparents. Then the grandparents will be the primary caregiver. Why? Because you're working outside, you only come back once a week and so forth. So this is where I would tell all the viewers today that it's really important. And sometimes please do not get offended if I ask you to ask, like, can I see your mother-in-law? It's not that I want to ask her something else or what. It's just that because to me, I always tell this to parents that, okay, you all can come together, whoever that taking care of that person, please attend the initial consultation. Why? Because I want to know your point of view and the parents' point of view, because the one that taking care of the child definitely will see more. Okay, no offense. I'm not trying to offend anyone. I'm not trying to ask more questions from different, but basically, I assume that in your situation, Liyana, you will be the same, right?
Yes, yes, that's right. Sometimes when you mention about the parents need to be in the session, right? I often also experience that because of the wife is busy or due to work, she's not able to present, but because they had made an appointment, so the father attend the session instead. So when I ask questions about the child, probably the father could not answer as much as the mother would. So that would also affect, and that would take more time for me to assess. So probably I would also ask the mother to attend the next session, or both of them to attend the next session. So it's going to take more time. So the intake interview will take another session. So it takes, instead of one session, so it has extended to 2 sessions. So that would cost more on the parents. So just parents out there, just be aware, if you want to come for an assessment or a consultation, make sure to attend. For those who has taken who has given time, a lot of time to the child, make sure you attend so that you can answer questions from the clinical psychologist or counselors or whoever that is present there for you.
Yeah. So that is one of the expectation as well. Before you engage in any assessment, who are the one that taking care? Sometimes we ask this, to be honest, no offense, we are not trying to like saying that, oh, this person is better than the other person. No, we are just want to know who are the one that taking care. Yes, you are the parents, but
Who
at the
has more
moment,
experience with the child?
correct. This experience in terms of like direct experience,
Direct experience.
not like experience. Okay. So you have, because you are taking care, definitely you experience the child more than those who doesn't provide care, or this is what we call a secondary caregiver. Primary is the one that giving constant care. Secondary. So um, sometimes it might sound harsh, like, oh, you're the primary, I'm the secondary, but the secondary is the parents, the primary is the grandparents. Don't take it in a negative way. This is just how we want to know, how we gain information from you. Okay, like an example where Miss Liyana said that, the assessment, CAS assessment for autism can go as young as 1.5 years old. Same goes to counseling. Sometimes I have parents who like, oh, I think my child needs counseling. Yeah, we do a lot of talking, but if the child won't talk, then there will be no therapy. This is what I always tell parents. That's why it's very important for us that if the child don't talk, can I talk to someone else instead? Okay, it's not that I'm choosing side or I'm picking side. It's just that this is how we, through talking or through interviewing, this is how we do assessment or screening. Okay, this is just a expectation for parents, cause stakeholders, like who are the one that going to be in there, and then if the person couldn't attend, then it will prolong the assessment, which will incur higher costs for the treatment. Okay, and then that's why you can see these term stakeholders, primary caregiver, secondary caregiver. A lot of these questions. If you don't understand, please do ask. I mean, we are more than happy to help, or to ask. I like to explain to you what is it. Same goes to other like hospital. Feel free to ask. Okay, and this from there, you can see that this is basically from the point of view of a psychologist. And then the next one will be when parents talk about treatment. Okay, this is what Liyana has summed up just now, which is quite good. She tells us everything about when diagnosis to, how long, what's the process, how many sessions.
No
and
more
then
secrets from my side.
Correct. And then towards the end, which is recommendation. Recommendation, it can be a treatment planning. It is a treatment planning way. They recommend you what to do with the schools or what to do. And then that's where stakeholders include, like, if your child need an OT for fine motor skills, she said that just now, FMS, fine motor skill, then she will recommend you to go for an OT, okay, occupational therapy session. Then from there, OT can get information from Liyana, and then they can work together. These are also considered the stakeholders, okay? Like for your child, let's say your child in a company, okay, these are the stakeholders that will working with your child, an OT, a clinical psychologist. And then normally at the end of the report recommendation, that's where the clinical psychologist, like what Liyana explained just now, will give you the direction what to do next. If you're not sure after the session, I believe that you can call back the clinic and ask, I'm not sure about this part, can you explain? Maybe the clinical psychologist will set an appointment to see you with or without charges, I'm not sure. So this is where you can ask them. Okay, sometimes for my session, I allow parents to record what I say. Why? Because sometimes I talk too much, they can't write down. So I was like, okay, you know what? You can just record what I say, and then they can listen and play it back what to do next. Okay, so this is what Liyana has said just now. Towards the end, you have a recommendation what to do next. So by doing after the class, because today the main topic is about autism. So autism, they can affect you in different aspects of life. Sometimes it needs another assessment or separate assessment, because CARS assessment is only to find out autism. Yes or no? Do my child has autism? Then you go for CARS, which is what Liyana explained. There's two types, GARS and CARS. This is what she preferred to use. From there, this assessment itself can only tell you yes or no to the question of, do my child has autism? Okay, and then from there, she explained also, she will recommend or suggest to parent what to do next. We do behavior or developmental milestone to see what are the delays. And then after that, from the delays, you can see in terms of fine motor skills, speech, if speech there's delay, speech therapy. If the fine motor skill or sensory issue or daily living, activity daily living, there's also one component inside, right? Then this is all under occupational therapy. Okay, and then the latest, or not the latest, is this behavior. Clinical psychologists can address, or there's another therapy that can do, which is behavior therapy to address the behavior issues. So these are the recommendation or the treatment plan or the intervention planning at the end of the session, which is covered by your clinical psychologist. So please, parents or anyone that if you decide to send your child for an assessment, please do ask. And also recommendation, also one more thing that Ms. Liyana talked about is government hospital, correct? So
Yes.
I believe you can also look for clinical psychologists in government.
Yes, yes. Usually in government hospital, the psychiatrist, the child psychiatrist would go for the screening, right? So it's been recommended for the from the child psychiatrist to see that, okay, from the medical perspective and also the biological perspective, so there are significant affecting the brain of the child. So they would recommend for the clinical psychologist to do the assessment. All right, and then the clinical psychologist would do the assessment with whatever that was mentioned just now by me. So, and then the same procedures. So that would be the process. So probably from KK, go to see MO, and when MO would point you out to the child psychiatrist, and the child psychiatrist would point you out to the clinical psychologist in the hospital. Yeah.
Okay. All right. Sorry, we have one question. I just saw. I'm so sorry, towards the end. Okay. From Miss Jessie, my son is non-verbal. How do you assess him if he can't answer the questions? I feel he really needs a psychologist consultation for us to understand him better. He was not formally diagnosed as autistic or cerebral palsy. I assume CP, not clinical psychologist, right? Okay, autistic or CP. Where can I find you, Miss Liyana, or is there a link or list of clinical psychologists? Okay, Miss Jessie, it's good. We're gonna break it. First, he can't answer the question, how do you assess him?
Okay, how old is the child? Did she mention?
Nope.
No. Okay. Like say, take it for example, if the child is 6 years and below, right? If the child is not able to speak or to verbally say things, right? So one thing, whether we want to know whether the child understands instructions or not, all right? So if the child is able to understand instructions, for example, not just the familiar instructions. Yeah, sorry.
Sorry,
Yes.
just replied, 16 years old, teenager,
16.
non-verbal, 16, 1-6.
Okay, 1-6. All right. So if if it's a teenager, then nonverbal means that not being able to say words. All right, not by purposely not saying things. All right, so if it's nonverbal means that cannot pronounce or cannot speak very well, means that you need to go to see speech therapy. All right, but if the child is, or if the teenager, your child is able to understand things, all right,
Yes,
so means that
can.
can understand. Very fast as one. So if your child can understand, can say yes or no, can say what they want or what not say, but show what they want or not. All right, so if it's a teenager, they can show it by their behaviors, right? Do you like this? Okay. Do you want to do this? All right. So if they're able to do that, all right, then we can work with, like, say, for example, emotional regulations and whatnot, being able to communicate during like different sign, maybe text or sign language, but that would be more under um, occupational therapy or speech therapy. So if it's difficulty in terms of medically or biologically that's preventing them from being able to verbally express, then you would have to see a medical doctor to get it checked. All right. So if there's no problem with medical or biological issues, then you would have to go to the speech therapy. If it's regarding to the emotional regulation, maybe you can see a counselor or clinical psychologist, or sometimes occupation therapy can also help with emotional regulation. So it's your choice where you want to send, but make sure that you know what is the issue. So let's say, for example, you don't know what is the foundation of the issue of your child, right? So go for a screening, go see clinical psychologist, go see a psychiatrist, get it checked first so that we know what are the foundations. Like I mentioned earlier, we need to look at several developmental milestones, whether we know whether this child can do this or cannot do this. So that is where we can direct you one by one. So I cannot explain to you and give you directly here, because when there's a lot of things that we need to cover, right? I can just give you a brief assumption of what you can do and where you can look for. All right, I hope you understand that.
Yep. So Jessie, you can go for a screening or schedule an initial consultation with us. You can find Miss Liyana with us. Mind Story. If you look at our page, we have our phone number, and you can contact us for initial because it's really big. There's a lot of things that we need to consider before we give any assessment. We need to understand your child's situation. And then also, second thing is, yes, there's a list of clinical psychologists. It's called MSCP, Malaysian Society of Clinical Psychology. You can go in and there's a list of who is the registered member of that society. Okay, and then the second one is, can I know if a child will cry and don't allow parents to talk on the phone or face-to-face? Is it under the spectrum? Will throw things on the floor, but once finished talk, will not throw things or cry. Is it the child want us to pay attention to her, or is in the spectrum? 4-year-old child.
All right, so the child would throw tantrum.
There's a second part. 4-year-old child. The child last time scared of strangers, but now after early intervention program, she has improved. No longer scared of strangers, but getting very friendly to others. It is an improvement, or being too friendly is also a problem in a spectrum?
All right, like I said, it's difficult for me to explain here because there's a lot of aspects that I need to cover. All right, so like I mentioned just now, we need to look at the criteria, the main criteria. All right, it has to be ongoing and it has to prolong, and those are the certain things that I need to know, the informations. I need to know the intensity, I need to know the frequency, so and the period. So I need to know what causes that behavior. Like I said, during my consultation, I would ask whether if that that behavior or is shown because of other factors and not because of neurodevelopmental issues, so those are the things I need to screen first. So it's difficult for me to say yes or no here, because I don't want to give a wrong impression towards the child's behavior. So I really hope you do understand that. So if you want to know whether why your child is behaving certain way, is it for attention? Is it because of neurodevelopmental issues? So I think it's appropriate for you to seek help for to the appropriate person. Yes.
Yep. Yeah. So, and the second part, I would say that if for EIP, early intervention program, whether it's improvement or is it a problem of a spectrum, this one you can speak to the person that provide the EIP. They have the direction, they have certain goals. Like for example, at this age, your child will have to achieve certain goals, okay, and then they work from it. Then you can see whether is it a progress or is it something that fall in the spectrum of autism. Okay, so also another thing that the criteria of autism is based, it's from the criteria guideline that a trained clinical psychologist, they have to define it in, well, you have to define it and you are trained to observe this kind of behavior. For me or anyone else who are not trained in clinical psychologists, if we see the event is just one-off or 1 or 2, 3 days, you can ask, but I would not suggest immediately put it under the spectrum because you know, it needs some time to develop. But it's good that you ask, so we can let you know. But like what Ms. Liyana said also, we can't really say that whether it's attention or is it under the spectrum. But please talk to the EIP people because they will certainly tell you and guide you. Okay, all right. I get we already at 4 o'clock at the end of this Facebook Live. Thanks for joining us today. If you have any questions that we couldn't answer now, you can put in a comment or you can contact us at our Facebook page. You can just comment under the video or you can contact us on our number that provided. For those who are looking for autism assessment, you can find Miss Liyana with us at Mind Story. You can schedule an appointment to see her for initial consultation. Okay, and here we do provide assessment for autism, which is CARS. Okay, and then from there, after the assessment, she will recommend what to do next. Okay, thank you for attending our Facebook Live. And then do check out our page for our next live. We're going to talk about other types of special needs, okay, or neurodevelopmental or emotional behavior. Do check out our page. All right, thank you everyone. Thank you, Liyana, for your time today.
Thank you so much, Harry, for having me. Thank you, Mind Story.
All right, see you on the next Facebook Live. Bye-bye.
Bye.